The most frequent tumor in the world, the lung cancer, is responsible for over 17 million of deaths per year, making it the most frequent cancer-related cause of death. Hi, and welcome to MediStop. In this video we will approach a more challenging topic, lung cancer. Which are the risk factors? Smoking, alongside other risk factors, like the chronic inhalation of asbestos, is considered to be the reason for developing this tumor. Which are the types of lung cancer? Histologically, the lung cancer is divided into a small cell carcinoma and a non-small cell carcinoma. The non-small cell carcinoma is then formed by adenocarcinoma and the squamous carcinoma. The small cell carcinoma originates in the neuroendocrine cells, being able to produce polypeptide hormones. It often arises centrally, near the main bronchi or the trachea. The small cell carcinoma metastasizes early, and it is overall a very aggressive type of cancer. The adenocarcinoma originates from the glandular cells, which secretes mucus, and it is usually located more along the outer edges of the lungs. It is the most frequent type of cancer in non-smokers. The squamous carcinoma arises from in the central part of the lung, or in one of the main bronchi. It tends to spread locally and to metastasize rather late. This is the type specific for smokers. The symptoms are primarily represented by the presence of a long-lasting cough, which often is disregarded by the patient, hemoptysis, which occur when a large tumor bleeds into the airway, and dyspnea, when a large airway is blocked by the tumor. Generally, it is exercise-induced dyspnea. However, the patient may also have recurrent infections, being a result of a post-obstructive mechanism, and the chest pain, when the pleura is affected by the invasion of the tumoral process. Before moving forward to the diagnosis, remember, if you like this video, hit that subscribe button for more content like this. How can you diagnose this disease? The investigations begin with a chest X-ray, which can show a clear sign of a tumoral structure like a mass lesion or consequences of the tumoral invasion of the nearby tissues, such as pleural effusion, usually unilateral. If the patient is symptomatic, the X-ray shows abnormal results most of the time. A CT scan is very useful in order to evaluate the extension of the primary tumor and the involvement of other organs. Moreover, a CT scan must always include images of the liver and the adrenal glands because they represent main sites for metastasis. Alongside this technique, a PET-CT may be used to complete our understanding of the patient's condition. Usually, if there is no suspicion of a nerve compression or involvement of the brain such as cerebral metastasis, the MRI is not used. The staging of the lung cancer is based on three components: the tumor, the involvement of the lymph nodes, and the metastasis found in other organs. Here is a TNM staging. Stage 1. The tumor has less than 3 centimeters. Stage 2. The tumor has less than 3 centimeters, but there is one metastasis. Stage 3. The tumor has more than 3 centimeters and more metastasis. Stage 4. The tumor is spread in other organs. In reality, the staging of lung cancer is more complicated than this one. This is just a simplified version made for educational purposes. Nevertheless, in order to make a diagnosis of certainty, we will need a biopsy of the lung or of a lymph node, which can be obtained with a fine needle aspiration. The imaging techniques are especially important for the tumoral staging and to choose the adequate therapy. Do you know what other disease is very dangerous and very common in the same time? Type 2 diabetes. So, click on the pop-up to find out more. How can you treat lung cancer? Among treatment options, surgery would be the best, but it can only be performed on patients in the early stages of the disease, no more than stage 3A. Chemotherapy and radiotherapy are used in association with surgery so as to improve the general outcome of the illness, especially for those with a non-small cell carcinoma. They can be used both before and after surgery. Unfortunately, for patients with terminal disease, their only option is palliative care, in order to make their life as comfortable as possible. For today's video, that would be it. If you like this content, don't forget to subscribe and let me know your thoughts about this topic into the comment section. Thank you for watching.